Okay. All right. So it's 2:58. We're gonna give folks a few more minutes to wander in late. Because we have a lot of attendees, we are not going to do introductions, but if you want to, you can put in chat how long you've been doing guardianship and what part of the state, just so we kind of know. But you can do that, but we just don't have time today for actual introduction. So update is this did get approved for the credit. It was pending, but it is approved for legal credit. So you'll get your stuff from Kate that you always get, and it'll have your CEs that you're looking for. Okay. All right. So while people are still logging on, Julie, do you want to bring up, let's see, let's start with the Genie board.
Okay. Yep. Hold on.
So guys, I want you to put on your imagination and pretend that you're in I Dream of Genie land. And you can write down in chat your wish. If money wasn't a hindrance, what would you like to see solved in guardianship? Like on the list there's somebody who wrote they wanted a PR campaign to talk about all the good guardians do. And then someone else wrote
we got one that says like, I'm looking for a final resting place for 16 boxes of cremains.
There you go.
Save the exam committee shortage problem by providing exam training often and create an outreach to find more qualified exam committee members.
Perfect.
Or some of these are hard to read from the picture Kate sent over. A statewide registry for searching for cremains. So it sounds like cremains are a hot topic.
Cremains are a hot topic. So because you guys, if you're not at FSGA, which is where this physically is today, please put in chat. Think about it. Let your mind wander. But perfect world, if AGID ended up with some funding that did not have an absolute plan, and we could create a program that would solve some problem in guardianship, what would you like to see? So that's our first thing. All right. We got some people talking in chat here. Why can't I see my chat? What did I do wrong? There we go. Okay.
I have a couple of comments to make on that.
Only guardianship, Tom, nothing else.
Well, I got a referral yesterday from an attorney out of Tampa looking for an attorney who could help his client do a cemetery.
Oh, wow.
Build a cemetery?
Yes.
Okay, well, tell him I need some free land so we can put all these guardians' ashes somewhere. Oh my God.
I'm going to keep you guys in mind. If it make it happen, I'm going to tell them.
Okay. Oh, this is funny. Facility education for the ALF facilities and memory care facilities about what guardianship is all about. Oh God, Tom, that's right up your alley, baby.
I talk about it in core training in general, believe me. So
all right. Okay. All right. Okay. So that's what you guys keep doing that. Keep adding them because we're going to use this to make a decision about programs to create in the future. So, all right, it's 3:02. Let's start with this. We got a few more minutes. One more thing, Julie, because I don't want to do this at the end. Would you bring up the GSI flyer? So if you guys haven't attended the GSI class, this is something that AGID does physically in person. It's not by Zoom. It's at AGID's office in Longwood. And this is coming up. The next time is August 21st and then October 7th. It's a really unique class. We created this 15 years ago, and it's now back on track because we have AGID's big building to put it in. It's a very complicated 60 minutes. You got to really work hard at figuring out all the clues for the word, and you just got to point at ETG, and you got 1 hour to figure their life out. And then we do an hour and a half review. Then we do it again in a second scenario. It's awesome. We have tons of credits. I think Kate's got 6 hours of credits, and they're all your favorite credits, the ones that are hard to get. Exploitation and ethics and all kinds of them. So please consider coming to this. If not in August, then do it in October. All right. So I think we're good with all our little salesy pitchy stuff. So, okay. Thank you, Ashley. Ashley said this is a fantastic training. Think escape room meets guardianship. Good description. Okay. All right. So we're going to introduce, well, first of all, Julie, introduce yourself so people know who you are.
Hi guys, I'm the director of marketing at AGID. So Kate's at the FSGA Guardian conference with all the guardians right now. So I'm running backup for her. So usually Kate's the one that sends out the emails and does all the great stuff for you guys. And then I have to help support her. So I'm on agent side helping you guys out.
Yep. Julie and Kate are the reason why all this stuff exists. If it was me, good luck, because I can't do tech. So for those of you who haven't met in person, my name is Teresa Barton. I was a professional guardian for 30 years. I have a long-standing joke that I stole from Lenny Burke, which is I am now a recovering professional guardian. And now I do a lot of mentoring to try to make it easier for you all to walk the same path that I did with maybe a little less trouble, maybe. All right. So if you got questions during the presentation, so that we can make our time, we're going to do those at the end, but you can put them in chat as you think about them. All right, so I think we've given enough time for folks. It's 3:04, so I think we're going to get this rolling. So first of all, from a personal point of view, I've known Tom Campbell for 30 years or so, 28 years or so. And he actually, believe it or not, was involved in Aged's inception 20 years ago.
Yep.
So Tom has been a great personal friend to me. He's a great referral. He knows a lot about ALFs. He's built them. He's sold them. He's bought them. And he teaches the ALF core training. So that's why Tom's here today. So Tom, would you do the rest of the introduction of the rest of the stuff you want people to know about you?
Okay, I will. I'm going to go ahead and share my slides, if that's okay.
Yeah.
And hopefully we'll get it to work. And from the beginning. All right. Can you see it?
Perfect.
All righty, great. Thank you. Good afternoon, everybody. Yes, my name is Tom Campbell, and I am a licensed ALF core trainer with the Agency for Healthcare Administration. And this is my 23rd year of teaching ALF administrators. Next year will be my 24th, maybe my last, we'll see. But I'm going to talk to you about some of the regulatory changes we've had over the years. And I'm going to share some words of wisdom with you on some things. And then I hopefully answer some of the questions for you afterwards. But I am a consultant. My company is Tom Campbell and Associates, and we have 3 divisions. We have a management company, and we currently manage a building in Sanford, Florida called Marina Isle Waterfront Assisted Living. I also have a contract with Poinciana Gardens in Key West, Florida, and work as a consultant for the Housing Authority of Key West. So it's funny, both of my management contracts are on islands. So I think I'm going to have to change to island management or something and hopefully get one on Captiva or Sanibel. But hey, that's
Perfect.
just a dream of mine. I also have a consulting division. I do a lot of ALF compliance, a lot of front-end application, change of ownership work for my clients, and work with a lot of chains, bigger ALF chains, but a lot of smaller ones as well. And then my claim to fame again is training, which I've been doing the full-time gig for 23 years. And before that, I actually taught for Department of Elder Affairs a 2-hour mental health track all the way back to 1992. So yeah, I was 12 back then, so we won't age myself. But this is my slide, and you'll have access to the slide. I do a monthly radio show called the Tom Radio Webinar Show. It is a monthly webinar for ALF professionals, and it's free, so anybody can join. And basically what I do there is I give everybody a regulatory update, what's going on regulation-wise. I usually pick a regulatory topic of choice, and then we talk about what's trending out there as far as when the Agency for Healthcare Administration is doing surveys. So that is a show that anybody can attend. If you're a certified ALF administrator, we give 1 CE for their actual certification. And then there's a link to my website. And so if you ever come to my radio show, you'll hear me say, check us out at www.tomcampbellalftrainer.com about 15 times on the front end. If you do go to my website, there is a resource button or link that is where I get most of my information, and that's where I spend most of my time when I'm surfing, looking for the information that I'm going to share with you today. And just so you know, the information I share with you today is the most current I can find at this time. And even though I am a licensed provider through the Agency for Healthcare Administration, they do not provide me with any insight into any of the changes that they have. In fact, I was told last night at the FSLA conference that they're in deep trouble. So, and I'm thinking, okay, well, tell me something I didn't already know. They have the same problem we all do in our world, and that's finding people to work. So, getting the people to come to work is one thing. Getting people to work when they get there is the other issue. So, and it trends all differently, because if I could tell you that the surveyors survey the same statewide, I'd be lying to you, and I wouldn't do that. So it's up to me to make sure I kind of wade through all of the regulatory stuff that goes along with the survey and the regulations, and make sure that information gets not only to the people who attend my show, but also to the students that I teach. And again, this is the 23rd year, and I believe I did my last count. I've trained about 7,000 people in the last 23 years.
Wow.
So, and I read the regulations every month, and for 10 years, twice a month. So, trying to get credit so I can become an attorney. I'm just kidding you. Again, that's my radio show. It's presented by my company. Here's the resource documents that I like to tell everybody about. When we talk about assisted living, there's really three main documents that I teach in my class. Now, we do additional information on fire and health department and the other related regulations that impact our licensure and operations. But Florida Statute 429 currently is the 2024 version. The new version will be posted on August 1st. So for any of you who are looking at new laws that come out from the legislative session, normally they get published on Florida Online Sunshine, which is the state website, by August 1st. I'll have a new updated version on my website posted. You just have to scroll down the main page or on the resource page, and you can find copies or links to those. The other document is an administrative code, which we call a rule, and that's 59A-36. And then we have an additional statute that governs our licensure itself, which is called the healthcare licensure law, and that affects all 25 providers that ACA regulates. So what I like to talk to people about is, and some of this is some of the same information that I talk on my show, these administrative codes, which we call rules, and laws are done legislatively. Rules are done through a rule-making process. The word is called promulgation. And the Agency for Healthcare Administration is currently our rule maker. So I always go in and look every month to see what is currently trending in the rulemaking process. And when we talk about rulemaking, we're talking about proposed rules. And when you get a copy of these slides, there's a link to flrules.org, and you can look up any administrative code in Florida at any time. You can download a copy of it in a Microsoft Word document, which I do every year in August when I redo my legislative or my regulatory guide. So that's something that we look at. And just right now, so you know, there is a current rule in promulgation, or a proposed rule, that relates to admitting people to an ALF that might have a communicable disease transmitted through air droplet transmission. And basically, in all intents and purposes, it's addressing the respiratory viruses, and the fact that when people come in the door, they are positive, and the fact that we will and can admit those people under certain rules, which means they would go straight into isolation precautions. Now, after 2 years of COVID, everybody should be well versed in isolation precautions at the ALF level. And the funny thing is when we write our policies and procedures, which I'll tell you about here for some of the new the changes in the regulations, one of them is face masking, and the other was visitation, to correct the governor's faux pas when he restricted visitation during the COVID. And of course, you could never use the word COVID in any of those documents. The state kicks it back. They say you have to eliminate that. So I guess COVID's a bad word up in Tallahassee. But anyway, this is something they've been talking about for 2 years. It comes on my rulemaking website every couple of months. And this is just the people in Tallahassee changing language because there are special interest groups, as I'm sure you all know, if you're aware of the legislative process. Everybody has a piece of pie and everybody has something to say. You know, they say there's two things you never want to see being made. Sausage and the law would be those. So this year's legislative session for assisted living, it wasn't very remarkable at all. And the only thing that came through this is what's been fondly called the DVT, deep vein thrombosis law, or the Emily's Promises law. And this is a law that was passed into, it was signed into law by the governor, and it just tells ALFs that they not only have to make potential residents aware of things that could happen with deep vein thrombosis and throw in a blood clot, as we would say, and also make sure not only our staff but our residents know it. So the originator of this particular statute or law is a man named Doug Adkins, and Doug's based out of Hilliard, Florida. Him and his wife Janet, she was a former legislator. Their daughter Emily had a ankle injury, and one day she had a blood clot and died. So this is kind of their way to memorialize it. And the thing is, amongst my peer group, everybody's thinking, you know, we don't need another law. And when Doug called me about it, I basically said, you know, he said, would you be willing to train this in core training? I said, certainly. And I've already started to do this. What it's going to end up doing is we'll end up having to have a brochure or a poster that we have to make available to residents in our admission package. And then we will probably end up having to include this in one of our trainings for staff called the pre-service orientation. Right now, it's all kind of under development. And I spoke to Doug last week. He says they are doing a brochure for it. So this legislative session was pretty much unremarkable. I haven't heard yet about any of the funding because every year they're looking to increase the Medicaid funding for ALFs, but I see that trend slows down every year because nursing homes, they're not wanting to give up their slice of the pie. And you can't blame them because most of them are giving up their rehab business back to the hospitals. But it's kind of interesting to sit and watch it and see where everybody's going to be in the future as far as nursing homes are concerned. But anyway, that's what's going on there. And again, the new law will be out. Now, I'm going to go through a few of the changes that have occurred, and some of these are going to go all the way back to 2020. Because on July 1 of 2020, a lot of things happened that year legislatively, and then August 16th of 21 is when all the rules came out. And these are substantial things that you might find quite interesting as I go through. One of the first things that they've done is for Alzheimer's training. Now, previously, only ALFs that advertised that they gave memory care or they were memory care facilities, or they dealt with Alzheimer's and related disorders, or if they maintained secured areas for memory care residents, they were required to do Alzheimer's training level 1 and level 2, and that was provided through USF, the University of South Florida. 2 years ago, the state decided all ALFs need to have some form of training because just because Tom's not in a memory care doesn't mean he might not have a form of dementia. And of course, most of us know about the progression of the disease. And at the front end, we could be one thing, but towards the end with the level of confusion and the wandering might require some type of supportive setting that is secured. Oh, and by the way, there was a big discussion this year during the legislative session on defining the word memory care resident and some related regulations, which when I did my research is already in our regulations anyway. but I think this is kind of the trend towards creating some more regulations for memory care specific ALFs, which believe me, I think definitely they need. This is a link to the training. Now, Department of Elder Affairs took that training over. They used to contract it out to USF. And Dr. Heyer, who was over there, was the catalyst to get some of this Alzheimer's training and the elopement regulations in place, passed away several years ago. And so when this switched back to DOEA, I wasn't surprised. One of the main things they did, and anybody can go in and take that class, but they give a free hour training that is required for all ALF staff to take. And it is free. So if you don't know, or if you haven't heard about this or didn't know about this, this might be a very good resource for all of you to
Yeah.
take.
Yeah, I never thought of that.
Yeah, there's also there's a graph there or a table that basically tells you non-memory care specific and what they're required to do, and then memory care and what they're required to do. And the differences between the two are going to be the initial, we have to
Oops.
provide them with initial
Did we lose
information.
Tom? I can't hear him.
I'm sorry.
Teresa, he's fine. We can still hear him.
Oh, can you hear me?
Yeah, go ahead, Tom.
All right. Okay. So anyway, you'll see the training differs. With the memory care specific, the training, they have additional 4 hours of training, and then they have annual training as well. So that was a positive change. The instructor for the video that DOEA made, his name is Keith Gibson, and he works for the Alzheimer's Association, but he was one of the original Department of Elder Affairs trainers way back prior to 2002, and he does a very good job. The one thing that we do need to remember on our ALF side is that when we do use instructors for this training, they have to be approved through DOEA and have to use an approved curriculum. So it's not like anybody can go out and train this course. There are certain requirements that they have to do. And as I tell everybody, if you're using an online provider, just make sure they're approved, because I'd hate for you to do 8 hours of training for nothing and be disqualified by the agency.
Mm.
So training's big for me, and I'm not one to do online education, especially for my administrator's course. I'm one of the only instructors in Florida who does not do it online. So I like mine live. It gives me a chance to see my students and to share with them some of the good, the bad, and the ugly of assisted living. Because the reality in my world is when I got into this business, I never thought I would be doing it. And of course, we all learn the hard way. And that's what Teresa was saying. She does a lot of mentorings. And I tell everybody in my classes, you're going to get the advantage of what I call the 23-year shortcut. I'm going to tell you all the things I should have learned on the front end so you can get that now. So remember that birds of the feather comment. Okay, background screening. We had changes in our law in January 1 of 24. This required us to update our roster every 5 days. And of course, ACA did such a great job, they didn't tell anybody till the end of February. So did I say they were having problems? But there is a new attestation of compliance form out. This is a form that everybody has to sign that says that they attest under the penalty of perjury that they meet the standards for level 2 background screening, which is a nationwide FBI check requiring electronic fingerprinting and a photograph so they can be enrolled in the database or the background screening clearinghouse database. So there's a new form out for that. Mainly, they just added a few more disqualifying offenses related to human trafficking and a few other ones. Again, this form is available on my website currently. Just go to the resource link and scroll down. And I think I might have sent some to you already. That I made some available in my email that you're more than welcome to share. Or if any forms you can't find, just reach out to Teresa and they can shoot me an email, or you can shoot me an email. It's tomc at tomcampbellalftrainer.com. There's also a new exemption form because some people may have some disqualifying offenses that well, as I tell people, some people might have got into some trouble when they were younger that they regret today. Well, there is an exemption process that they could go through, and if they're approved, they can work in an ALF, pursuant to the pleasure of the assisted living facility who can pick and choose. So, again, this is changes in background screening. I'm not sure if any of you are familiar, but there is a new DNRO out, do not resuscitate order form. I'm going to click this link and see if it's going to come up for me.
Oh, I want to see this because we've been fighting about this all week.
Here she blows.
If not, did you include that in your email, Tom? Because
I think I might have. I'll have to look. Just shoot me an email follow-up and I'll send you whatever you need. Okay, if I didn't.
Can you guys see it?
Actually, you did send it to us. I could stop your screen share and share it on my screen if you want.
Is it not big enough for you?
It's spinning. It hasn't pulled up. So we can't.
Is this a little bigger for everybody to see?
All we see is your 2025 mid-year regulatory update slide. We don't see the form.
Oh, okay. Well, I wonder why that did that. Okay, well, let me go back. All right, see if you can pull it up.
Yeah, I have it up. Hold on. I'm gonna interrupt your share. So hold on 1 second.
Thank you, Julie. Yeah, I definitely want to see it.
While she's doing that, there's also a frequently asked questions form too. Ah, perfect. Yeah. So, what's funny about this is I was looking at the statute 765 and I noticed that they had added a PA as somebody who could sign. And I thought, when the heck did that happen?
Roll to the bottom, Julie. I want to see the date. It's always been February of 2024. Is this? Oh, okay. Okay. This is the one we've been operating on, Tom. This is not new. No, it's not for us anyway. This is the one we've been operating on.
Well, it just came around our world recently. So,
okay. All right.
Yeah. And the deal is that, back in 2020, when APRNs or ARMPs changed to APRNs and some of them became autonomous, they were allowed to sign the DNR, even though it didn't indicate it on the old form.
Yeah.
Now they can. And it says autonomous practice registered nurse, a physician, a PA.
And Tom, so there's two pieces, just foundational. The reason why this was the Rebecca Furley era. That's why this changed, number one.
Yep.
And number two is statutorily, this thing knocks heads with 765 because the judges in guardianship won't let us have a PA sign. Has to be an MD.
Got it.
Yeah. So that's a whole another time where the government's not talking to each other.
May I ask a question?
Sure.
In order for a guardian to execute a DNR on one of their wards, do you have to have a court order or permission of the court?
So the answer is unequivocally yes.
Okay.
Before it was most of the time. Now the one time that they can get out of it now is if they're in a hospital and it meets this long criteria of 765. I forget which para chapter it is in 765. There's a very special circumstance in which if they're in the hospital, basically imminently dying without a DNR, and there's a long list of things they have to match, the guardian can then sign the DNR in the hospital, but it doesn't move from the hospital. So for example, if that person's stabilized and was going to go to an inpatient hospice unit, the DNR does not leave the hospital.
Okay.
It's a statutorily stupid decision. If they'd have just added, inpatient hospice, then we wouldn't have to go through these bells and whistles, but the legislators didn't think about that. They only put it on the hospital. So, Kimberly, we'll answer the questions at the end. Sorry, we got to keep going. All right, Tom. And I do, Tom, at the end, I want to talk a little bit more about DNR, but I don't want to use your time.
Okay.
So you don't have to reshare your screen, Tom.
I figured I did.
Form you want me to pull up. I can pull up something else if you want.
Okay. So there are frequently asked questions for DNRs. That's a handout as well. I'm not going to try to click on that. But that answers the question. And here's what I tell everybody, because that was what I was going to say. First question I get, do we have to execute DNRs on the new form? And the answer is no. The old form is in effect until we execute on the new form. Okay. My problem in the ALF world is that the wrong people are signing who do not have the legal authorization. And it's called that word called power of attorney, or POA, which drives me bonkers.
Right. And Tom,
Okay.
the other problem that a lot of guardians experience is the ALF doesn't know the difference between guardian of the person and guardian of the property, or they don't know the difference between plenary and limited. So,
Got it.
I always talk to guardians about when you walk into a facility and you give your letters of guardianship, go over them with them, because every letters of guardianship can be very different, and you may not have the authority. You may be guardian of the bill to the facility, but you're not consenting to anything. That's
Yeah.
one of the struggles.
Yeah. Are y'all familiar with the post physicians? Yeah. Okay. I just bring this up in my group, in my trainings, because I don't want people to think a post is a DNR. The one thing that's difficult in Florida, there's over 3,000 ALFs, okay, from 5-bed homes all the way up to, let's see, the biggest one I've licensed was 350 beds.
Wow.
So, and there's a huge disparity between the two from a lot of different standpoints. You all probably go around to more ALFs than I do, so you all see it. Or you talk to a hospice person or a home health person who goes into ALs, and they know the differences between the two. And I'm sure you all do as well. We all have problems, some of us less than others. There was a new emergency management template put into place, went into effect 11/23 of 23, which requires a new template and a new plan. And the funny thing about emergency management is it's no longer the CEMP. It's called the minimum emergency management criteria, whatever, the MIMP. Okay, so we have to change it. I wanted to put the progressive there and call it the pimp, but nobody wants to listen to that. um, but anyway, it's addressing some of the issues we have with the hurricanes coming through. And the thing about these plans is when you're a newly licensed ALF, it's just a template. You really don't know how good it is until you have to use it. But here in Seminole County, where we're located up at Marine Isle, we're very fortunate. We have a very good person there in the office that works very closely with us. And Jody, who is my executive director, she's the guru of emergency management plans. She works very closely with Stephen Lerner over there. So we haven't had any problems with that. This year we didn't, or last year we didn't have to evacuate because we got tiger dams. So, which if
You
you have
got what? You got what?
tiger dams, they're big round tubes filled with water. They go all the way down the causeway to prevent
Wow.
the road from flooding.
Oh, I did not know that. That's fantastic.
Yeah, we sent the mayor a thank you note, and he published it on Facebook, and all the neighbors complained because they didn't get tiger dams too. You try to do something good and it slaps you in the butt. All right, let's talk about some of the changes in 2020 and 2021. And it says updated policies. Again, this is an adaptation of the thing I do for my ALFs. And so let's start off with the very first one, which is very controversial because as of July 1 of 2020, an ALF may physically restrain a resident under certain circumstances. And 5 years later, after much thought and deliberation and me sitting back waiting for the pioneers to get all the arrows to see how it was going to roll out, I can tell you, and this is very thoughtful on my part, the only time this may be appropriate would be somebody who is at risk for falls. And the problem we have is that the agency will never tell us how many times somebody has to fall before we have to move them to another level of care. And then the other catch 22 is they may not have the ability to go to another level of care because maybe they don't have a funding source, or they've used up all their days. And of course, my prediction is you'll see less and less nursing homes over the next 10 years. So what that has created is a situation where ALFs have to think a little bit differently. Now, my initial policy was no physical restraints at all. I've changed my policy in the sense that if the healthcare team that manages the resident can get together with everybody, all parties, all responsible parties, and the healthcare team, and they make a recommendation to the risk manager for a physical restraint, then I have a waiver clause that we might allow it. Now, the waiver and the risk manager in my building in Sanford is me, which means ultimately nobody has the physical restraint without my permission. And we haven't had to do that yet, but we've come close to a discussion because somebody who's simply sliding out of their chair, Broda cushions and seat belts and all of those things, they only become a physical restraint when the resident is no longer able to remove or avoid the device independently.
Okay.
If somebody has half bed rails on their bed and they can remove or avoid it independently, the bed rails are no longer considered a physical restraint. They're an assisted device that assists them in positioning.
I have to go
Okay.
back. No.
So likewise, with that change in the law, they added the definition of assisted devices, which could be devices to use for transferring, to prevent a fall, for ADLs, which means now we can use slide boards to help transfer. We can use transfer belts to help transfer. But the thing that most ALFs didn't catch, which I did and we do, is training. You can't use a slide board without people being properly trained. I mean, there's tons of safety issues from a transfer standpoint anyway. And we're finding, because our residents aging in place, the need to help to assist with transfer is becoming more prominent or more common. So that was a real big deal. The other one, which I'm sorry I don't have listed on here, and I don't know why. Yeah, hospice. The hospice regulations changed on July 1 of 2020, and it allows us now as an ALF to admit somebody under hospice who does not meet the criteria for admission. Prior to July 1 of 2020, for admission, a resident had to meet the admission criteria under the regulations. After admission, and they aged in place, residents who no longer met the criteria for admission could go on to hospice, and they could stay as long as the agreement was the arrangement was mutually agreeable to all parties. Well, the rationale is, if it's good enough after admission, why wouldn't it be okay prior to admission? So that's why they do it. And as I tell everybody, listen, if you've got somebody who's bedridden that you're admitted under hospice, you have a very high level of care. And the question is, can you meet that person's needs? I mean, that's always where it's going to go. And for me, and I know for a fact that some ALFs out there employ the Carvana concept. They bring them to the door and try them out, and then they want to send them back, and that stuff doesn't happen like it's supposed to. We don't do that.
So
And
Tom, one little caveat to that situation is guardians can admit a ward onto hospice without a DNR and put them in your building. The problem is, of course, is if they start to code. Everybody is going to have to take an action, and they're going to get put in an ambulance and sent back to the hospital. And I've heard guardians say, well, I can go ahead and put them on hospice and I'll get the DNR later down the road. That's the risk. That's the risk of doing that.
Yeah.
So it's a problem because I don't want them riding in the back of an ambulance if I can avoid it. So, and I don't think the facility administrators are aware of that nuance necessarily.
Well, they are if they take my class, because one of my education sponsors is VITAS, and I've been working very closely with them over the years to help them hopefully understand. But again, we've had issues even with them in my building, from the sense that they have to use agency staff that aren't their normal staff, that don't it doesn't comply. 20 years ago when I was at the place at Maitland, I had the same RN for 2.5 years and the same CNAs from hospitals for 2.5 years. And that just promotes continuity of care. Now it's a revolving door.
Yeah.
So we're very fortunate. We have a nurse from Vitas who doesn't mess around, and they won't move her out of our building. So, because they know I'll complain. So hospice was a big change along with the physical restraint. We also had changes in third-party services in our policy that relate to the facilitation and coordination of care and the responsibilities of ALFs to meet the needs of their residents who choose to use us or who choose to have us facilitate and coordinate their care. And the bottom line is that sometimes as an ALF, we have third-party providers who won't cooperate. So we have to show at least 2 documented attempts on 2 separate occasions that we tried in order to meet the standard, because the state says, well, y'all sat around for years and this was happening and you never did anything about it. Now we want to see you do something about it at least twice. Okay. We had a small change in infection control, which was just talking about cleaning equipment. Again, all of these were things that had to be addressed in the ALF's policies and procedures. But the one thing that a lot of ALFs didn't get, that maybe some of you might note in the future, is they didn't change their contracts or resident handbooks to reflect the changes in those regs. So a lot of people are using outdated materials for their admission package that do not necessarily reflect the information that was in there. And then, of course, many of you probably know about the No Patient Left Alone Act, where the visitation rules changed for people who are under isolation, and the fact that they can have visitors, which is the governor's way to correct his mistake, as I would say, and that's my opinion. Quite frankly, if that ever happened again, I would probably thumb my nose up at the state and allow visitation anyway. And hindsight's always clear. The hardest part about COVID, one of the hardest parts for COVID for me, is we opened our building right in February of 2020. So yeah, all of our depositors, they decided not to join us because they couldn't
Wow, I
have
remember that.
visitation. Oh yeah, it's taking us a while to catch up. And then again, the governor came out with a face masking policy about where we have policies that say people do not have to wear face masks, those kinds of things. And again, those are all information. In fact, No Patient Left Alone and the face masking policy is going to be in Florida Statute 408, which is one of the references I did. In fact, I'll tell you what, Teresa, after I update my regulatory guide, I'll send you all a copy and you can do what you want with it.
Oh, great. Thank you. That's
It'll
wonderful.
be electronic. Okay.
Perfect. Perfect.
And you can go from there. All right. Now let's talk about some things that have been going on out there that we have to look at on survey trends, which I call the bad stuff. And this is still happening. So I would say, as a guardian, or from my standpoint, and to you as guardians, when you're putting one of your wars, or as I believe that's what you call it, or okay, you might want to make sure that the ALF's clear on what happens with the DNR, because our biggest problem is that there have been multiple instances in the last 4 years where failure to honor DNR has become a problem. And the reason for it is nobody knows who has one.
Mm.
And a part of the other reason for it is that we are required to do DNR training, and we are required to train people to policy and procedure. But because everybody wants to use online training, and since those providers who do online training don't have your policy, what has to happen with an online training is you would have to sit down with your staff and go over your policy physically with them so they understood what it meant, including how you identify who has a DNR. That would be a very good question for you to put on your Guardian hit list.
Okay.
Okay, I can tell you how we do it. Our staff all have a badge. It's yellow, and it's only by room number. So there's no resident information. They use radios, code yellow, room 222, and it's just that quick. I saw it happen because I was in a meeting with the owner and with my executive director, Jody, code yellow comes up, sheet pops up, the cook out of the kitchen grabs the AED, and they run to the resident's room. It was that quick.
Wow.
Yeah.
Okay.
Yep. And then abuse, neglect, and exploitation. For some reason, we're having issues because people just do not want to call DCF and report abuse, neglect, and exploitation. Well, we have a rule in my building in Sanford, which I teach everybody in all my classes. If we have even reason to believe, we're calling. And we do. And so much so that we have a very great working relationship with DCF. In fact, Jody just won an award and recognition from them again on a case that somebody was being exploited, because these are red flags that we get in the admission process, and we take it very seriously. People say, you call every time somebody used the word abuse? Yeah, we had a gentleman, a family member said, well, that's abusive. We called right away. He got mad because we called the state. Well, we were only doing our job because we're required to do it. There's no choice. Okay. It's the state's job to figure it out or not. And this has happened. I could show you a case study at another time of an ALF down in Southeast Florida that got over $200,000 in fines because they failed to report abuse and the abuser had not been background screened. So that's $200,000 in fines, which they whittled down through negotiation. That doesn't talk about the legal fees they had to pay. The other is elopement from memory care. And again, if elopement from memory care happens and it's an adverse incident that's reportable to the state, 99% of the time, the ALF is going to get a class 2 deficiency, direct probability of physical or emotional harm. It's a finable offense, and it's a $1,000 to $5,000 fine.
Wow.
Yeah. Background screening is trending because people aren't updating their screenings, or they're hiring people who are not eligible, but they hire them anyway. And I've seen all this. The health assessment forms, which could be a whole other webinar. We just met with the hospital in Sanford case managers and went through it with them, hoping that they would figure out how to do it the first time and save us all a hassle and trouble. But again, we can't guarantee the same people will be there next month. So it's kind of something that happens. And then right now, the big one is falls. This is what's trending here in the area 7, which is Orange, Osceola, Seminole, and Brevard. And it's supervision on falls. Usually these are complaints sent to ACA that they follow up on. And so because this is trending and this is a big deal now, and because the state won't tell us how many times somebody has to fall, this is where that physical restraint thing is going to come up in the future. Okay, so things just to look at. And then adverse incident reporting, we've got some problems with our area here. They want us to report everything, even though that's not how the regulations state. I'm not sure if, and see, I'm not going to click on the link because I don't know if my screen is going to come up. But Florida Health Finder is the state's website. You can look up any ALF in the state of Florida that you want to. It'll give you a lot of really good information. But what I would tell you to focus on is to scroll down. If they have a history of fines, then they also have their survey inspection reports. And if you like reading multiple pages, read the inspection reports. If you want to get a summary, click on inspection detail, and it'll tell you what people got cited for. And it's a very, very good website. It was meant and intended to be a consumer-friendly website, but the state did not send out any notices, so the general public and even my colleagues in the assisted living world don't even know this exists.
And it really works well. It's fine.
Oh, it is great. You know, I live in Winter Park, and I do in my class, Health Finder, I do a 5-mile radius around my house, 41 ALFs.
Wow.
41 ALFs.
Wow.
Within 5 miles of my house.
Okay.
Big and small. It's a great website and a good resource. If you haven't been there, check it out. You can always get to it off of my website at www.tomcampbellalftrainer.com. I think I'm going to do voiceovers at the airport when I retire. Questions?
So if you guys got a question, you can open up, look at chat. You can put it in chat, or
Okay.
you could wave your hand in the little audience,
I'll
or you
try
can
it.
come off of mute and start talking.
Oh, there it is. Chat. Got it.
Got it?
Okay.
Okay.
Ashley, thank you. Got another thank you.
Okay.
Guardian. Let's see. Like to see better options for adult. Yeah. Options who need supervised living. Amen to that. There's 3,000 of them. I wish that half of them were quality.
Yeah.
Unfortunately they aren't. I tell you, to be honest with you, in my humble opinion, I think smaller ALFs do better with memory care residents than these big 30 and 40 bed ones. In fact, I think the growth in the future will be some of the smaller homes run by quality people. We're
Right.
starting to see the big ALFs are starting to tail off on the new construction because there's one on every street corner now.
Mhm.
And again, so there's where I think it's going to be headed in the future. And we would definitely, if somebody wants to do a whole presentation on guardianship, I'd be glad to set up a webinar for my ALF people, or I could gladly have you come onto my show. In fact, Teresa, I haven't had you on the Tom Radio Show for several years.
Yeah, I'd be happy to do it again.
Yeah,
All
and
right. So let me come up with a question that I always struggle with. So, Tom, you put someone in a building and everything's going well, and then a department becomes a problem, whether it's dietary or nursing or housekeeping or admin. Oh, thanks, Julie. Julie just put health finder
I
on
can
the
share it for you guys later. We use it
Yeah.
all the time at AGED for our rapid resource directory. It's a
Yeah.
great resource.
right there. So, I guess what I want, Tom, is give us the short answer of when we're not having success with some department at the ALF, whichever. But things aren't like, on fire. It's not a dumpster fire. We're just not having good success. Give me like some top pointers of what you would recommend we do to make things work better when we're concerned about our ward's care or things aren't going great. Give me some top pointers.
oh boy, this is a very common issue.
Yeah.
Not just with guardians. I mean, I've had home health people go to the administrator to say, hey, your resident has a complaint, and then they're trying to kick the home health out because they're troublemakers. I would tell you that by regulation, the buck stops with the administrator.
Okay.
And if you can't get any resolution through the manager of that department, then by all means, you might want to ask to speak to both of them at the same time. Sometimes the department heads don't pass on the complaints they get, so the administrator doesn't know.
Okay.
I'd also advise you to put it in an email in writing, so there's something recorded that says it's there, and make sure that they verify they received it.
Okay. I like that.
I would probably do a summary of notes in any meeting that I would do. And if so, review it with the people at the end. And so we're all on the same page. And if that doesn't work, then, you have other options there. The
Okay.
ombudsman are there for resident rights. You can file a complaint with the agency. In fact, most of when you go into an ALF, they're required to post a complaints poster with all of the different things. And in a lot of cases, if it's corporate America, they have phone numbers that you can call the main corporate line and complain, or as a resident and family member. And hopefully you'll get somebody that answers the phone and does the right thing.
Okay.
For me, it's
I-
always been about approach. For many years, the direct approach was my first course, and that didn't always work.
Me too. Me too.
Yeah.
All
Well,
right. Yeah, Tom, you and I are cut out of the same fabric. All right.
you know it. I mean,
Let's just cut to the chase, folks. So Kimberly says, I can't get my facility to get cockroaches in my ward's room under control. What would you say?
oh boy. Well, that's a complaint to ACA.
Okay.
I mean, nobody likes to complain. They were supposed to be anonymous. But if I was a guardian and I couldn't get cockroaches out of my residence room, I'd be screaming bloody murder.
God, I'd be embarrassed to death. Jeez,
Oh, I would probably be embarrassing them. but you know, it's not a, that'd be unacceptable.
Yeah,
There's
for
a lot
sure.
of different factors could be in there. In some cases, when residents store food in their rooms, or we get a resident that's a hoarder,
Yeah.
you know, those can be problematic. And the thing about hoarders is the Resident Bill of Rights addresses that and basically talks about if it becomes an unsafe situation, that we have the right to do something about it.
Okay.
Okay.
All right.
So they don't have the right to live in filth, nor should they not do so.
Hey, this is a great one. Monica says on Health Finder, it says the 6-bed ALF license expired January of 2025. Status says in process. The inspection was just completed last month, was not posted yet. The long-term care insurance company is saying they will only want to pay 70% because of the licensure issue. Man, this is cool, Monica. I've never heard of this.
I have. It's called license pending or in review.
No, I mean, I know that, but what I'm saying is I've never known that a long-term care insurance company will dock the fees based on a license review. I didn't know.
I think that's interesting. You know, I would, if I was a long-term care insurance company, I would probably refuse to pay anything at all.
Wow. So,
Yeah.
okay. So then she says, when calling the area supervisor, she says, no issues, license still good. So Tom, what did she do?
Okay. So here's the deal. Let me explain to you why this is. ACA is required to do renewal surveys every 2 years. ALFs are required to renew their license every 2 years, and they all get a notice 120 days prior to. What is happening is the agency can't keep enough surveyors on hand to address the workload.
Right.
So because they don't have enough surveyors on, they are behind. In the Jacksonville area alone, last I heard, they were 16 to 18 months behind.
Wow.
So what happens is that, you know, it's going to say in review on there because they haven't had their inspection. Now, in this particular case, they had their inspection, but they haven't posted it yet. And that's either going to be one of two issues. It's going to either be the field office didn't send it up in a timely manner, which we just had that happen not too long ago, or the people in Tallahassee aren't recording things like they're supposed to in a timely manner.
So what can the guardian do? Is there anything she can do to resolve this?
Yeah, have them send you an email and put it in writing.
Have the who's sending the email?
The area supervisor. If you call the area, and Monica
I
called.
did.
Yeah. Did you ever put it in any?
Yeah, what happened, Monica?
Yeah, she said, oh yeah, they had their inspection last month and, you know, we're working on it. Yeah, and she's like, the license is still good because if you look at it on Health Finder, it does say, you know, it expired in January. I imagine these insurance company just looked at that and said, that's it, it's not licensed. You know, now I haven't called them yet, and I knew I was coming to this session with you, Teresa and Tom, so I wanted to get your guys' thoughts on it. Yeah, weird, huh? But they're certainly behind. You're right, Tom. They, you know, they're
believe me, I have people who haven't gotten their renewal survey that had to renew their new license.
Oh man.
Yeah.
So what else should Monica do? She should get the email from the supervisor and provide that to the long-term care company. What else can she do?
No, I would tell her to email the supervisor and have the supervisor from ACA email the response back to her, which she can provide to the insurance company. If she had an email address on that insurance company, they could always copy them on the email to the ACA surveyor. So there you have a string of, you know, emails that would help you. This is happened. It was happening with Medicaid as well.
Okay. All right. Great. Okay. Kimberly thank you, Monica. Great question. I didn't even know long-term care did that. Fantastic. So Kimberly says, well, no food in the room. So the only comment I have, Kimberly, is this is a very, very, very personal experience. We had a client who was a hoarder, and Nick, I, and a bunch of staff from Aged and Guardian Care went to his house. We all personally ended up getting German cockroaches in our houses and in our car. Don't make that mistake again. Dumb decision, but we did. I found the magical German cockroach. It's tubes of stuff that you get on Amazon. It's a little expensive, but it's magical and it kills German cockroaches in a second. So for what that's worth, that was our horrible experience. They were in our cars. They were at the office. It was bad. So we made the mistake of bringing all those home when we were trying to clean his house out. So there is a really good product on Amazon that you make sure you say German cockroach and the right stuff will come up. All right, so let's see here. We've got, this is a very favorite one that everybody likes to talk about. What's your recommendation for hearing aids?
Hold on. I got one. I'm looking at the one about showers. Is that what
All
you're
right,
looking
go
at?
ahead. Do that one.
Okay. So here's the deal. Under the Resident Bill of Rights, okay, when residents, and in our regulations, actually, it is in the Resident Bill of Rights under discharge. 429.28 parens K is the reference. And it basically says that when residents engage in behavior that's harmful or offensive to other residents, then we can enact what's called an emergency discharge. And an emergency discharge is not immediate. It just waives the 45-day notice required under the Resident Bill of Rights. That would be my leverage. Okay, because yes.
To get the shower done?
Yep. Yep.
And of course, that leverage you're holding against me as the guardian or holding against the ward?
Well, that was where you have to use a little bit of that's where you and I would get together and have a strategy session on how we would tackle this, because I wouldn't want to go down that road independently. I would, if it's me, I'd want to be on the same page as you.
Okay.
And to put a clear plan together. This just came up recently, and it comes up everywhere we go. Just wait till the new generation of people called baby boomers come around the corner. They're going to want to be bathed every day. Are there any ALFs for age 40-year-olds with behavioral issues? They need a supervised facility, or Med Waiver does not pay her facility that she is at because they are not contracted. And her facility is now for brain injuries. Wow, that's a real tough one.
That is very tough.
It's a real tough one. I think anything tougher than that would be a sexual offender.
Yeah.
Yeah.
You know, Robin, maybe you could try just the right adult family care home where the resident there is their family member and has the similar issues. It's not a guarantee, because Medicaid is Medicaid paying any adult family care or only ALF?
I have no idea. Many years ago, I decided my brain was full, so I went ahead and ixnayed all of the information on AFCHs.
All right. I don't know. I at one point, if I recall, they were not Medicaid under home and community-based services was not going to pay adult family care. And as far as I know, that's how it still stands now. Oh boy. Robin, it's just a matter of calling every single ALF within a friggin' 5-hour radius of you and trying to find one.
Where are you located, Robin?
Oh, okay. I'm located in Marion County. My client is in Lake County.
Okay. Yeah, there's actually a memory care specific facility a brain injury facility over in the Tarpon Springs area. I believe they're a Medicaid funded ALF too. It's called Family Extended Care. That would be the only one I know. I know there used to be a brain injury specific ALF up in the Mount Dora. I don't even know if they're open anymore.
Carlton,
yes, they are, and that's where she's at. And they're
still open. They're still
yes.
Which one? What's the name?
New Life.
New Life.
They're still open.
Yeah. Okay,
yes.
good. I didn't know that.
They are a great place because she has fits all the time. Anybody else would have Baker acted her.
Yeah.
But they know that it's going to run its course and then she's going to settle down. And so they don't Baker act her. They try to bring her down or just give her some space. You know, she's 42 and this is the issue, is that her insurance company says we're not going to pay New Life anymore, but they can't come up with a
another
alternative of a alternative placement for her. And so I'm like, you know, I'm in an appeal right now with them because she's 42 and these other ALFs, they don't want to take her because their people are 80
She's way too young.
And if she throws a fit, that's gonna be pretty scary for these 80-year-olds.
Yeah. I see, is it pronounced Venetia? She says, yeah, New Life is different facility than Carlton. Carlton is closed. Sorry, I brought that up. Okay, Tom, here's my tough question. You know me, I put it on the table. In general, do you see most ALF contracts
1 mile at the roundabout.
having an arbitration signet requirement?
How did I know you were going to bring that up?
You knew it, my hot button.
Of course it is. And I'm going to just tell you, I already thought about it on my drive back from South Florida and the conference this morning, because I knew you were going to ask me. Our insurance companies require it.
Okay.
And that's why.
Okay, the reason I'm bringing this up, guys, is I want you to understand that when an arbitration section is in a contract, whether it's with an ALF or a home care agency or anybody, what you are doing is you are signing away your ward's civil, constitutional civil rights. And there's nothing in guardianship in 744 that gives you the authority to do that. So be exceedingly careful when you sign a contract, even Tom's, that has an arbitration agreement. You can talk to your attorney about ways to get around it. You can tell Tom, which is what Tom knows I do. I bring a Sharpie and I X out that arbitration and I sign the contract and we go on. But some facilities allow it, some don't. But you as a guardian, be careful, because what right do you have to give away your ward's civil rights to sue? That's what an arbitration does. So be aware of that.
Agreed.
And Tom isn't going to kick me in the shins, but he's thinking about it.
No, the bottom line is I've thought about it. And when this came up, when we had this conversation, I called my insurance company and they said, you've already got it in your contract. If you remove it, you have a claim, we're going to deny the claim.
So then let's talk real hard thing. If I bring a resident in and I sign the contract, but when we get to the contract signing and Jody and I are doing the paperwork and I'm the guardian and I X out the arbitration agreement, what decision are you going to make? You going to not accept my client? Maybe.
What I'm going to do is I'm going to
baby.
I'm going to call my owner and have a conversation.
Okay. So I just want you guys to be aware of this. I have, and I'm being very frank, I have signed contracts with arbitration agreements when facilities told me you can't place her here unless you sign it. But I'm always scared because I think I'm in trouble signing it, but I also need placement. So talk to your attorney about what to do. It's not every facility has an arbitration agreement, and not every arbitration agreement is a yes or no. Some of them are choose to sign it if you want to, but read that part. Don't just say, oh, I can sign this contract and assume that I understand what that means. And if you don't know what arbitration agreement means, talk to your attorney, read it, pull it up on Google, and just be informed so you know what you're walking into.
Yeah, in fact, go to AI and just say, print me out an arbitration agreement for assisted living facilities in Florida, and it'll give you everything you need to know.
Perfect. That's a great idea.
You know, and
All
by
right.
the way, for hearing aids, that's always a tough one. So
hearing aids, dentures, and glasses, God help us.
Oh yeah,
the
person who's doing this, and you're going, oh my God, they're having side effects from their medications, and Mrs. Jones has Mr. Smith's dentures in. So
so one of the things I learned about are all the different forms of marking. So like there's glasses where you can order the frames where they actually put the a name inside the plastic, where it's cooked into the plastic. I love those. You can actually get dentures made with the name in a plate, in the actual tooth plate, so that it's easy on the top, a little harder on the bottom. Hearing aids, it's a bigger problem because of their size for sure. All right, we got another question. She says, use a pocket talker. Oh, that's not a bad idea. Okay, that was Mark. All right, so we got a question here that says, this is from Janice. What is the ACA regulation on too many boxed meals being delivered to a room? Facility claims resident choose to eat in their room and they have the right to refuse eating in the dining room. My ward is not being charged and the number of meals is not being tracked.
okay, I'll answer this one.
Okay, the facility uses levels to bill for services. All right.
Okay, so here's the deal. All right, and this is something that I had been meaning to mention. The regulations that we go under are called the minimum standards for licensure, which means as long as we meet the minimum standards as set forth in the regulations, we have a license. Many ALFs choose to go over and above the minimum standards under regulations, which is called a best practice policy. What is first off, to answer your question, there is no regulation on boxed meals. That is not a regulatory question. That is a policy question. And what happens with policies is that over time, they become adopted as the standard of practice. And the next thing you know, everybody says it's a regulation when it's not. There's a difference between a regulation and a policy. And so a lot of times when ALFs don't want to do something for somebody, they'll say, oh, well, the regulations say we can't do it. Well, I know better because I know exactly what we can do and what we can't do. So the person who's telling you that is either telling you that because they're ignorant of the regulations and don't know, or they don't want to do it. They just can't be straight up and say, hey, Teresa, we don't do that. Now, as far as room service, most ALF policies, most of them allow tray service to the room. A lot of them are limited to when they are sick and they can't come out of their room. A lot of them do charge an extra charge for meal or tray service. We do that at our building because we have one lady who likes to have 2 of her 3 meals in her room every day. That's her choice. We encourage her to go to the dining room. Okay. But some people are just not social creatures. That'd be me. Okay. Honestly, the person you see here is not the real Tom. The one that's real Tom just prefers to be by himself and not talk, because I talk all day long.
Tom is the quintessential introvert extrovert in one package.
Yeah, well, Dr. Jekyll and Mr. Hyde.
There you go.
So to track meals, then they should have some type of tracking device. There's a software program we use in my building in Sanford that everybody, they're all signed in every day on everybody's meals, where they get tray service or whether they're in the dining room. And it prompts us to make sure that people aren't missing meals. It prompts staff to make sure they know who's in the dining room and who isn't. It works very, very well for us. Not all ALFs have those types of softwares or utilize them. Again, they're voluntary and not required. So, what it does, what we do know is that if a family member or a legal responsible party for that resident and the family ask for meals to be tracked, then that is a reasonable request.
Okay. All right. So now I got something I want everybody to think about, and Tom's going to chime in on this. So in the guardianship world, it is very common that we have a ward pass away. Technically, guardian of the person ends with a heartbeat. Okay. So the minute that ward passed away, guardian of the person ended. You've not been discharged until you filed your death certificate, but it did end. There is no person. So here's where the problem comes in. It's the 7th of the month and you just paid let's make it the 2nd of the month, and you have not yet paid for the month of July, and she died July 2nd. If you did not plan ahead and you don't have access to that ward's money after July 2nd as guardian of the property, because some courts take the position that dead means guardian of person and property. Statute doesn't say that, but some courts take that position. So when you are a newer guardian, talk to your attorney and say, I need to understand what my exit strategy is and to have a plan in place. My plan for all the years I was a guardian is if we were getting the indication that the ward was starting to decline, they were on hospice and they're starting to really decline, what my company policy was, we would pay 1 to 2 months ahead of time for all the bills, if I had the money, including the ALF, just in case, because sometimes there is no will, there's no personal representative to the estate, there's no access to the money. The judge gets mad at you because you paid bills after the ward died. So get it clear. This is not, we don't want to make the same mistake the United States made in Iraq or Iran. We need an exit strategy day one. So when you move them into a facility, any facility, Have a plan, because you're not going to control the day of the week that they pass away. Maybe they pass away after their Social Security check came or right before. You need to be ready, because what's then going to happen? If you're plenary of person and property and your court and your attorney say you can take care of any guardian of the property stuff for the next 30 days or so, great. Some courts will say you can pay the bills that are owed. You can't incur any new. Here's the problem. Let's say your bond premium's coming up for renewal. This is a client that has a $400,000 estate and you have a bond premium for $400,000. You won't be discharged within the next 2 weeks, but that bond premium is due. So always watch your cases. And as they start to decline and you see maybe the writing on the wall, talk to your attorney about, can I prepay things? Can I start talking to the kids about what's the plan for the stuff that's in the room? Because I got to get Tom's room empty. She's gone, can't pay another month's bill, and I don't want this problem. So be very aware that death and guardianship is this big no man's land that is treated different by every circuit, by many attorneys, by lots of judges. Find out what your circuit, your judge, your attorney, how they want you to handle it. And then my favorite way was to prepay everything. Insurance premiums, Tom's ALF bill, the caregiver agency, the Blue Cross Blue Shield secondary. I prepaid everything 2 to 3 months out if I had the money, because then whatever happens, however long it takes us to close everything out, those people just all write refund checks. They go right back in the guardianship. They're part of the final accounting, and then I close up shop. So be aware of that. It's an area that's not talked about in 744. It's not clear. It doesn't really have a plan, and you may not realize it until that horse is out of the barn. So talk about it with the facility, talk about it with your attorney, find out what the judge and the clerk want you to do in your circuit.
Well, thank you for that tip. And I'm going to add that to my spiel.
See, and here's why. I want Tom to be the kind of ALF that will put up with my crap and my ward's crap. So I want to make sure he doesn't get shorted on money if I have any ability, because here's what's going to happen. I can call Tom Jody at 2 o'clock in the morning. She'll meet me at the ER at the hospital, and we'll be doing an 1823, and she'll get them admitted for me, because they know my focus is to take care of them as well as then taking care of my wards. Yeah. The idea of shorting an ALF a payment because of the death of the ward, that bothers me. It's bad business. It's not professional. They don't have a huge profit margin to begin with. So I don't want them to lose money on my wards, because then in the future, they're going to say, I don't want a guardianship case. Forget it. So think about that as you're planning what's happening.
So I will make a comment. I just said it in my core training last week in Melbourne. Transitional living facilities, which are licensed by Florida, are required to have a discharge plan in place on the day of admission, which I think is a darn good idea. What if?
So when you say transitional, Tom, what's that actually mean? Is that a licensure?
It's a licensed one, and typically it's for spinal injuries and head injuries.
Okay, like specialty select, or okay, all right, cool.
Yeah.
Okay, all right. This was great, Tom. As always, fantastic. And you guys, Tom knows I'm going to put him on the spot because I want guardians protected. I want you making good decisions. I want you to be aware of problems, but we also have the other side that the ALF has to take care of its business. So it's 4:15. We usually try to wrap up by about 4:15, 4:30. So any more, Tom, do you got questions for guardians while we're here?
No, not really. I already gave you my question earlier. I'll follow up on an email.
All right.
For that client that I was telling you about, but I do appreciate everything that you all do. Obviously Teresa, the support of you and Aged and everybody over there is great. Jody loves you, and we do appreciate everything you've done.
Well, and Tom, I don't know if you know, but as a reminder, when you're talking to local ALFs, Aged is doing the DME thing. Basically, anytime, anyone, and it doesn't matter whether they're in the county, it doesn't matter what program they're in, Medicaid, ALF, at home, nothing. If they need a piece of DME, any kind of wheelchair, walker, Hoyer, hospital bed, anything, if they need something and Aged's got it with SIG from Cindy from SIG, It's right there. And either
Okay.
Nick and Shane will deliver it if it's a big piece, or they come and get it. Wheelchairs, walkers, and it's a constant revolving door because all the realtors know about aged, all the people who've lost facility members, even ALFs will drop stuff off because they have too many walkers and too many wheelchairs. So that's always available for, for anybody.
I'll make that sure that everybody knows that. We do know that because we send you stuff all the time.
There we go.
So,
all right, guys, this was great. Gosh, Tom, I wish I was here to give you a hug. This was fantastic. I hope everybody got a really lot out of it. I did this shit for 30 years, and here today I learned 3 or 4 things I had no idea about, which is always fantastic.
me too.
Anybody got a last question or a comment or anything they need?
We got a lot of thank yous. Everybody really thought it was a great session. So thank you, Tom, so very much.
My pleasure. And I'll look forward to doing it again with all of you.
All right. And Tom, when you send over that updated thing, we'll make sure we send it out to all the participants. Absolutely.
You got it.
Thank you, dear. Bye,
Be well.
everybody.
See ya.
Take care.
Bye, guys.
See if I can get